our special evening of our normal live webinar that we do on Wednesdays. So thank you for joining us tonight, and we're so glad to have you. For those that have never been on any of our webinars, we like to ensure that our voices are coming through okay. So if you'll see there's a little icon of a hand. If you'll click on that, and that will indicate to us that my voice is coming through. Because what we're going to try to do is have some interaction tonight, too, and we're going to kind of go through some of the steps to be able to ask Patrick and I some questions. So tonight I see that we've got David, Gary, Manish, Tammy, Terry, Vincent, John, Ruth. Good to have everybody here tonight. Steve, good to have you. So it looks like everybody is hearing my voice loud and clear, and we're just going to go ahead and get started because we certainly want to be able to get to all of your questions tonight. And again, as we kind of get started here, we're going to kind of share with you some of the steps of what to do to ask some of your questions. Again, I want to introduce myself. My name is Eric Ogea, the Director of Research and Development here at American Business Systems. We'll explain a little bit about what that really means to you and how that actually helps support you as a licensee. But before we get into that, let's talk about who American Business Systems is and what we do and really how long we've been around. We are fast approaching 20 years in this industry. And folks, a lot of times we get asked the question, are you selling any other franchises or anything else? This is all we do. We live, breathe, and eat medical billing. So, and it's to help people just like yourself that you see here on the screen to work together, work with a partner, work from home, and again, it's there to help you start a business and get in business. And as you know, and as some of the things we'll talk about tonight, is you really do want to be in your own business. If you haven't already begun to look at our website, you can go there at www.absystems, and that's with an S.com. There you'll find a lot of information. You'll see all of the different services there. And yes, folks, all of those services are included with the one price that we have. And then if you want more information, you would click on one of these orange buttons either here or there, and that will get you into what's called our virtual brochure. And for those that want to do a much deeper, more thorough due diligence, this is where you want to begin. Because each step along the way, whether it's the opportunity, the getting clients, this is how you learn about what we do here at American Business day in and day out, and plus what we can do to help you, number one, get your clients. We have been for quite some time now having an A+ rating with the Fort Worth Better Business Bureau. And for those that would like to come by and visit with us, our headquarters is here in the community just north of Fort Worth at 5751 Kroger Drive here in Keller, Texas. Again, that's just north of Fort Worth. So if you wanted to fly in, you'd fly into the DFW airport and then just contact us, and we'll see what we can do to make arrangements to have you at our office out here. We have an upcoming training, and folks, this is less than 2 weeks away. Actually, it's a week and a half away as of today. So just if you're looking to get into this business, we've got to encourage you to get your paperwork in. I already know some people that are actually on the webinar tonight that are going to be joining us. You can see there's only 7 seats left available for this particular class. And if you look at it, we're actually skipping the month of July. We don't have another class until August. So if you're really wanting to get involved in this, this is one of the classes you might want to be a part of. Let me introduce you to Patrick Phillips, our CEO of American Business Systems. He and his wife, or actually his wife Linda, helped get this business started, but he is the CEO and founder of American Business Systems. He is an author, been a co-author of several books here, but the one that he wrote independently called How to Reprogram Yourself for Success, which is sold on Amazon.com, and you can get a copy from us if you'd like. He co-authored the book in the middle called Wake Up, Live the Life You Love. And then the one that's more important to you as a licensee is Cash Crunch to Cash Flow. This is a book that will help you in your marketing. So, Patrick, let's get this thing kicked off tonight. Now, we've already got some questions coming in, but let's talk about how they can ask questions.
Yeah, people still coming in to the room. Thank you guys for showing up tonight. This is live, and so we appreciate you taking a little section of your evening like we are, doing this from our home. Eric's in his home, and mine's over here in Keller, and he's way out in the northwest part of Fort Worth. And We love doing these things, guys, because we interact with you and get to answer your questions. I don't know of many companies who do this kind of thing, Eric. This is pretty, we're pretty unique, aren't we?
We are, and there's a lot of people that I would say attempt to try to do some webinars, but I think after the 6-7 years we've been doing this, at least on the webinars live like this, I think we kind of got it down to what we're doing here.
Yeah, I did a live. I guess you would call it a Skype. We actually used a GoToMeeting, but a video with one of our licensees this past week. I do that from time to time, and he just couldn't believe that I was actually on the thing live with him, working in the evening like this. I said, you know what? This is my life. This is what I enjoy doing, and I love helping our licensee be successful. And we love the technology that allows us to do this and work from home like this. So. Hey, I see Dirk's on here tonight. Welcome to Dirk. He's actually one of our guys here that works in the office with us, and sometimes we actually have our own licensees and staff members join us on these to kind of absorb as much as they can about what goes on, too. They love to hear the questions from people looking into our business. So, yeah, let's tell them how to get into the little question box over there, Eric, and actually start asking the questions. So let me jump over here. I think there's a slide to that effect.
There we go.
Yeah, there's a little question box somewhere on that control panel that appeared on your screen when you started up GoToWebinar. There'll be some kind of control panel that looks similar to this. Just look for the question box. Click on the little arrow next to it if it's not open, and you'll have a little area there that you can just type in that question. Now, Eric, tonight we call it an open mic, so I thought what we'd try tonight is if anybody actually wants to, talk to us live, if they have a headset on, they're welcome to do that if they're on the computer. If not, they would need to call in on the telephone. You want to tell them how to switch there?
Sure, absolutely. Matter of fact, if you would like to speak to us and you have a microphone and a headset connected to your computer, what we'd ask you to do is just raise your hand and say, I've got a mic and I'd like to ask a question in the question box area. But if you'd like to call in, you could certainly call in. There is that number there that's 415. And I believe, Patrick, I think there is, you'd use
that one there is just a fake one. The way you do that, guys, is you go to your control panel and open up the audio panel if it's not showing. And if you're using the mic and speakers on your computer, this one will be checked. So what you want to do is check the telephone. And when you do, you'll see the real number that you should be dialing there. Don't dial this one.
Yeah, don't dial the one that we're showing you on the screen. So. But if you'd like to really have a conversation with Patrick and me tonight, we would love to have you. Again, this is for you. We kind of named this is the topic that you want to deal with instead of us driving the topic. So we certainly want to be able to help you out with that. Patrick, as we kind of get some things going here, you want to just jump into some of these questions, or do you want to kind of go over a little more review about really what revenue cycle management really is?
Yeah, let me talk about that just for a second. I threw the number back up here on the screen. This is the real number and the code that you should be using that you see at the bottom of the screen right now. So if you want to write that down, you can do that. But when you switch over there on your audio control panel to telephone, it will show you the number and the code right there, so you don't have to worry about that.
There you go.
Let's talk about that revenue cycle, because for a lot of people looking into medical billing, they think that it's just, sending out the medical claims to the insurance companies and helping the doctor get paid for those. But it's much more than that, folks. We call it the revenue cycle. That's how the doctor refers to it. And in a doctor's office, there's several ways that the doctor's revenue can be hindered, and they can have problems. And we cover all of those in our live training workshop here in Dallas. We go through every one of the 6 that you see on the screen here and address how the different services that we've come up with as a company can help you solve those problems for doctors. So, Eric, they're really not even, we don't even call them medical billers, do we?
No, we don't. And we actually try to stay away from that because, whenever our licensees are just starting to get marketing, we want to make sure that they're talking about the right things, and revenue cycle management is what the doctors will understand, and it puts you higher above than just being a regular medical billing company.
Yeah, this is what distinguishes you in the marketplace out there, folks, from other people who will be offering the doctor medical billing services. There are other medical billing companies out there, right? You're aware of that, of course. Some doctors have already outsourced their billing to some of those companies, and there's always new doctors looking. Look, we get sign-ups every day here in our office from our licensees for doctors who've switched. That is, they've switched from one company to another. Maybe they weren't happy with the billing company they were using, or maybe they were using their own staff and their own computer software in their own office, and they just weren't happy with the results. Gosh, there's a lot of things that those office managers and the office staff does for the doctor, and so the medical billing part is really not, they haven't been trained for that. They're not specialists in that. We can train you to be the specialist that can help them with that.
And so what I was going to share with them on that again is the doctors are looking to not just get their billing under control, but again, all the aspects that Patrick has up there, the receivables, the reimbursements, really keyed upon the electronic medical records, and all the services that we have meet those requirements to help you as a medical revenue cycle specialist, whether it's with iClaim, which is the billing portion, or Code Write, or Quick Collect, or any of these services that we have. And yes, folks, all of these services are included with your investment here with us here at American Business System.
Yeah, and if you're kind of new to looking into this business, of course, you'd have to go back to our website and hopefully go through our virtual brochure that Eric talked about earlier to really see the detail on each one of these services. I know these little, these are 8.5 by 11 flyers that we've just got illustrated here on the screen, but each one of these services, like Eric said, addresses a different aspect of that revenue cycle and can help you stand out in the marketplace out there. Eric, I see a question already here from Latish. She's just asking, in general, what will I be doing each day in this business?
Well, that's a great question. Well, first of all, once you've got your client in which we help you to get that done, certainly go refer back to that virtual brochure and how we help you get that. But what you'll be doing on a daily basis is literally working with the doctor, collecting their information from him or his staff or her and her staff on the procedures or the encounters that they have during that day. And when we say encounters, we're talking about every single patient that they see. And whether they're using the electronic medical records platform or they are still possibly using paper, which would be the super bill or the encounter form, you'd get a stack of those, and then as you see here on the screen, you'd be using iClaim to literally input that information into the system to process those claims. And, you know, Patrick, sometimes it's hard to grasp for some, but some that can understand this, not only do we have a medical billing platform to process those claims, but we have a built-in, I wouldn't even say built-in, it's all integrated, our own clearinghouse. And, folks, that's what's important about the differentiation between our system and any other systems. Patrick, you want to kind of talk to them about what I mean about the clearinghouse and why that's important, that it's integrated with our system?
Yeah, when you get into medical billing, folks, you could, of course, set up with each and every one of the insurance companies out there in America to send those claims to them electronically. The problem is that they each want to receive that data in a different format. And so there are entities, usually publicly owned large companies called clearinghouses. Just Google that term, clearinghouse, and you'll see that those companies take that data from you, from our system, when you hit the submit button, and they take that data and reformat it the way each one of the insurance companies wants to receive it. They also do some extra scrubbing on the back end. Now, our software has built-in error checking, but for some things behind the scenes, only the clearinghouses can catch things. So they do that function as well. Now, with most systems, you'll be actually hooking up with a clearinghouse on your own. That's a pretty involved, difficult thing to do. Lots of paperwork involved in it. And unless you have been in this industry and know what you're doing, it can be a real headache. And you'll pay for each one of the claims that are sent through that clearinghouse. You'll be paying anywhere from 50 cents to $1 to have that claim formatted and sent on to the insurance company and scrubbed. With our system, folks, it's all built in. In other words, it is integrated into the system so that you don't have to worry about that. We've done all the work for you behind the scenes. All you do is submit the claims, and they go through the clearinghouse and are submitted at no charge to you. That's the biggest difference, I guess.
Correct, and it's just all included. And here's the nice thing again: as soon as that claim is processed through our scrubbers, and then they go through the clearinghouse, we're kind of that middleman that normally has to go out and let that claim sit out there for 2 or 3 days. We're processing that actually, Patrick, in real time.
Yeah.
And so as soon as that claim gets done and it's processed, it's going to the payers. And when we're talking about the payers, we're talking about your Blue Cross Blue Shields or Aetnas or anything else like that. That's where, folks, this is where we're making the difference, and this is how we're getting not only licensees, new clients, but getting those doctors up and going and getting their cash flow going in a much better format.
Yeah, so Leticia, to answer your question, basically you'll be getting that information from the doctor. We're going to show you how you do that through our system, totally electronically. There's no paper involved here, no faxing, no emails. It's done through an electronic system that we have called iDocs Now. Once you've got that data, of course, you can then put that into our system electronically again and submit that claim for the doctor. The insurance company gets the claim, they accept the claim, pay the claim, and the money is sent directly to the doctor. The way you get paid is our system, of course, will tell you how many claims you submitted that month for the doctor and how much dollar value there is, and usually you're charging a percentage of that to the doctor. So you'll bill the doctor basically using any invoicing program. We've got several that we recommend, like QuickBooks, and you'll submit your invoice, and the doctor pays you on a percentage of the dollars collected. So that's the whole business in a nutshell there.
That's exactly it. Patrick,
Right.
do we want to try to see if there's anybody here that would like to talk to us live?
Yes, again, folks, you just hit the little hand button there if you'd like for us to unmute you, and we'll let you talk directly to us. Now, if you're not on a headset, if you're just on your computer, which it looks like most people are tonight, our system tells us who's on the phone, that will be difficult because there'll be some feedback. So if you just want to type it in, that's fine. We can read them out loud. We'll just read your first name so you know that we're reading your question. And Eric, why don't you jump into some of the questions there, and we'll just watch for the hands to go up and
Absolutely.
see if any come up.
Take another one here. Here's Gary, and Gary's asking the question. This is a great question, and I'm going to pose it to you, Patrick. What are some of the common mistakes made by new ABS owners?
Oh, the common mistakes. Wow. Well, there's actually several that come to my mind immediately, and the reason I know about these is because our support department will refer back to me every once in a while that a licensee is called in and is having maybe a problem with a certain thing, and it turns out that the licensee is trying to maybe attempt, let's say, a marketing idea on their own that we did not tell them, actually works. Folks, we've been in this for 20 years, so we know what works and we know what doesn't work. We spend a lot of money testing things out. So sometimes they'll go out and try something out, or maybe they create their own marketing piece, and they'll pass that back to us and say, what do you think about this? And Eric, we've seen some pretty horrendous marketing pieces, haven't we?
Yeah,
people have created on their own computer and printed on their own printers. So I would say the most common mistake that I hear most often is that very one, that people are attempting to do things on their own. They're attempting to recreate the wheel, so to speak, because maybe they've had some background, maybe they've owned the business in the past or currently own one, and they think they know what they're doing. Well, folks, this business is very unique. It's taken us 20 years to figure this out, and don't go out and reinvent the wheel. Just do what we tell you to do. Follow our step-by-step turnkey system, and it works.
Well, let's kind of continue that thought there, and why don't you tell them what we're doing with the research and development, because I think that goes hand in hand of what we're talking about with the marketing pieces and what we've learned and how we actually came up with doing something like that.
Yeah, Eric has been with us now going on 6 years, I think, isn't Eric? And
correct.
We brought him in as Director of Research and Development because, folks, we not only teach you what's going on out in the billing world, but we wanted to have our hands right in the middle of that pie. So Eric actually signed up a doctor here in Fort Worth that we're doing the billing for, and we've been using him as, I guess, can we call him a guinea pig? I guess he doesn't mind being called that, Eric. But Dr. Bussell has been very gracious in letting us really use him as our laboratory to know what works and what doesn't work. And Eric has even tested out many of the marketing ideas that he and I have come up with. He's gone out and tested them and found out that they actually do work or that they don't work. And we pass that on, of course, to our licensees. So we're constantly doing the research, folks, to make sure that we're on the leading edge of what's happening in this industry. We also bring in for our live training workshops real licensees that have gone through our training. The two ladies that we're bringing in right now, both of them have been with us, what, Eric, about 5 years, going on 6 years, I guess,
correct,
themselves. Right. And they're licensees that are actually running their business out in their individual cities. And but we pay them to come in and do this training, folks, because we want you to hear from people that are really out there doing the business. And boy, it's just a very unique experience here. You will not get this kind of experience with anybody training people how to do medical billing or coding. We have the most unique experience, I think, in that 1 week's training down here of anybody in America.
Yeah, and it is, I think what makes it very unique, Patrick, is the fact that, again, I think a lot of people come in with somewhat of an expectation that we're going to teach them how actually to do medical billing. But I think you've kind of said it in the past, if you don't have a client, even though you might be in this business, it doesn't matter if you know how to do medical billing. So
That's
I think one of those key elements that we really work on and work towards is, like Patrick was saying, that's why we test the marketing. That's why we go out there and we do the research and development. That's why we make sure that what brochures we have work, and the verbiage that we talk about, and we get the feedback to our trainers here in class to say, you know, these are the things that we're seeing that doctors are going, yes, I need to know more about, or let's just stay away from this one particular area. But again, that's what we're doing here with the research and development side of everything.
I don't know that we answered Gary's question, and maybe I'm not real clear as to what kind of mistakes he's looking for that licensees make, whether it's in the marketing area like I mentioned or in some other area. But Gary, if that's not clear, just clarify that in the question box there, and we'll continue on.
Absolutely. I don't see any hands going up to where we can go live with anybody just yet, but let's continue on, and I'll start down here, and let's see if I can get, let's see, we got one here from Tammy. All right, so what if they are still using paper bills? That would be those super bills, or those encounter forms that I mentioned. How would we get those super bills to go electronic? Would it be fax or scan?
Well, okay, so let me go back to show you this particular screen here. This is the one that shows the different services, and there's one I mentioned in the bottom right-hand corner called iDocs Now. Now, folks, this is an electronic, secure document management system. And when you first sign up a doctor, one of the things we teach you to do is to get a setup fee. Eric, that's running right now somewhere around maybe $1,500 to $2,500, depending on the doctor. But included in that setup fee, you include for the doctor a little small scanner. Your cost on that scanner is about $400. This is a very powerful scanner that's made specifically for this type of system. You can stack in a stack of 15 or 20 pages at a time, push one button, and both sides of those pieces of paper, no matter what size and shape the paper is, they all go through and scan those documents in electronically. Now, once they're in the system, you, on your end, remember it's a web-based system, right? So that doctor and his office staff have scanned the data in on their end in their office. You then can go in and log into that very same system through any internet browser, and boom, you're looking right on the screen at the documents that they just scanned in, literally in real time, within seconds. And so you go in and look at their particular folder that they've scanned those into each day, and that's how you know how to get the data from them. So we're turning paper into electronic documents.
Correct. And so, but it's not to be too confused, I don't want to confuse Tammy here. That when we scan those in there, those are for us to actually do some of the data entry. It won't scan that in and then populate all the information in there. You still have to get that done, but
right.
it is an electronic format now of that super bill.
And Tammy, that's because each doctor's office has designed and come up with their own super bills. Each of them look different, so it would be impossible to design a system that would know how to scan that data in electronically. Besides, some of them are printed forms that the doctor simply has written on or circled numbers on. So again, that has to be your job, and thank goodness that you do have to do the work to get paid for this, but you take that data then and enter it into our system, into our electronic online web-based billing system.
Okay, let's take another question here. Here's one from Davis, and Davis is asking the question about training. So Patrick, what training is provided by ABS for delivery of these various services that you have on the screen?
Well, one of the things we do, of course, in that week-long training class down here in Dallas, Davis, is to go through each one of these in detail. We cover what the service is, how it works, how to market that service, how to price the service, and what kind of money you can make offering that service. So that's all covered in the week-long training class. Remember, we've got a total of 5 days of training, so we've got plenty of time to cover each one of those services in detail. Then, once you become a licensee, you have access to an online web-based support site for our licensees. And Eric, I haven't ever added up the hours of training that are on there, but there's got to be 50, 60 hours, maybe more.
Sure.
I don't know. There's lots of training on there too.
Yep, and not even that. Not only do we have that portion of it, we have the live training that Patrick's talking to you about the week long, and then we have our licensee support site. But Patrick, let's talk to him about the webinars that we actually hold for our licensees on a continual basis for support.
Yes, well, for the past 3 or 4 weeks, we've had one every Friday. We have a full hour-long webinar. It's live, just like this one, except it's for our licensees, and we're teaching them more in depth about each one of these things. All of those, of course, are open for questions and answers from our licensees, just like this one is tonight. And we record all of those and post those out there on that licensee support site that I just mentioned. So basically, we're adding another hour of training every week, at least, to that licensee support site. And you can go watch those 24/7 from any web-enabled device.
Correct. And again, and then I'd have to even add this, and there is sometimes one-on-one training if you need some extra help on some things. So, but most importantly, not only do we have that, even with iClaim in and of itself, Patrick, how many hours of training do you think that are just on the iClaim training side? I mean, there's just
dozens at least. Yeah. And like Eric said, our support people have the technology to be able to connect with you individually. When you call in and need some help, we can connect with you individually through technology like we're using here tonight called GoToMeeting. And with that, we can connect with you, and if you have a webcam, we can see you, you can see us. Our support people are talking to you like you're sitting right in front of them, and then we can take charge of your screen, or you can take charge of our screen, and we can share data and documents and get into the live online billing system live and actually work with you as if we're sitting right beside you. Folks, it's the technology that allows us to support our licensees in a way that was unheard of even 5 years ago.
Yeah, and very cost-effective for you as a licensee and cost-effective for us. All right, Davis, I hope that answered your question there. Now I'm going to turn to another person by the name of David. And David's asking the question, what is the normal turnaround time using ABS for doctors getting paid to what the others have used? So, what's kind of, once you've got your doctor involved with iClaim, Patrick, what kind of turnaround are we going to be able to see of getting those doctors paid?
Okay, now here's the amazing part, folks, and again, thank you, David, for that question, because this does set you apart from a lot of other medical billing companies that are out there that do not have the web-based, cloud-based system that we have. Folks, we're doing everything we do in real time. And that makes a huge difference in the turnaround time from the time you submit the claim for the doctor to the time that he actually gets the money. Now, Eric, I don't know what the record is so far, but I know that I have heard of a licensee who sent the claim in on Monday, and the doctor had the money in their account on Friday of that same week. Now, that's probably not typical. That's one of the shorter times, but the average is around 14 days. Now, folks, if that sounds long to you, you should hear what the average is for the industry. Industry-wide, that's somewhere around 45 to 60 days that most doctors get their money. So we're turning the money around in much shorter time.
And for the doctors, that immediately creates a positive cash flow. That's what, and again, that's where not only can you share it with the doctor and set those types of expectations, but it will be fairly shortly afterwards that the doctors actually recognize it and see that on there.
Yeah, it's known in business as the time value of money. In other words, having that money in his bank account within 2 weeks versus 45 or to 60 days means that that doctor has that money available for investing, building his, adding on to his office, buying new equipment, or giving his staff bonuses, whatever he wants to do with the money. But that's very valuable to a business person.
Right. Patrick, I know that we haven't even shared some of this, and I think maybe you have on some previous webinars, but I want to kind of tag along with what you're saying there. It's one thing that the doctors actually get paid a little bit quicker, but we know that we've got some new updates with iClaim that have some new dashboard reporting that actually helps the doctors kind of see how they're doing with other doctors in their own field. And so there's these new metrics that have come out that will actually help the doctor see if they're doing too much of one procedure, can they balance that out, can they actually increase one. It's very, very impressive. So I know I kind of went a little bit more into what David's asking there about a kind of a turnaround, but not only do you get the quick turnaround, David, you're actually going to get some really good reporting mechanisms to actually help you. Well, Patrick's got one up there right now called benchmarking with the EMRX dashboard. So here is what other established offices may be doing with percentages, and it's really going to help the doctors really get tied into what they should be doing.
Yeah, it's a glimpse from the doctor's standpoint. Remember, you can give access to your doctors to your system so that they can see certain aspects of it, and this is one of them. And the doctors just go bonkers when they see this, Eric, because this is real-time data on the status of their claims. This particular one is showing this particular doctor is billing for certain procedure codes that you see down here in the bottom, and 72% of his are at a particular level when he could be billing probably for a different level, which would be more money to the doctor. So these are cash flow snapshots, we call it, using this dashboard that's built into the electronic medical record system. So I had that just kind of back in the background there, Eric.
No, that's really good because, again, if you see this report here, you can see that I think that looks like the 99212. Well, what Patrick is showing you here is these are the codes that the doctors actually get paid upon. And it looks like that's roughly 72% there, and his 99213s are at 17%. If the doctor changed one more thing, could actually create that visit going from a 99212 to a 99213, which in there can increase the doctor's cash flow. So these are the things that we want to work with you on as a licensee in turn to how you're going to be able to help the doctors, again, actually increase their cash flow.
Yeah, good.
Yep. Okay, let's continue on. Let's see, Manish, let's see what we've got here. Do we have to get another license from the state or any other licenses from any government bodies to operate this billing business from home? So, Patrick, you want to address, because we get asked that a lot. Not only do we have our licensing fee, a lot of people are asking about, do I have to have a certain license or certain requirements I have to meet if I'm going to operate within my own state?
Yeah, and that's important that you realize, folks, that you don't have to have any other, not only license, but you don't have to have any other training besides what we give you to be able to do medical billing for doctors. We do give you a certification at the end of the training week here in Dallas, so you are a certified medical reimbursement specialist. But as far as licensing from your state or from some government agency of some sort, there is nothing required besides what we can train you and teach you and give you through our training.
That's exactly right. And so the only thing, let's add that one little caveat there, the only thing that you're going to want to have is to get set up in some type of business entity, whether it's an LLC or a C Corp or something like that. That you're going to want to have, but there are no requirements that we know as from a federal, state, or local level. So you're good to go.
Yep.
All right. Again, I don't see any hands that are coming up, Patrick, to go live with us tonight.
I actually see some people on the phone there. They're actually on their telephone instead of on the computer, which means they could talk to us live if they wanted to, but we're not going to call out your name. You just raise your hand if you want to talk to us, and we'll unmute you, and you'll be able to ask your question live. But type it in. That's fine.
Yep, keep typing. Keep these coming in. Let's see. Here's another one from Davis. Davis is asking another one. Who at ABS should a new licensee connect with in order to learn the correct process for setting up an iClaim customer?
Can you read that one more time and maybe interpret that for me?
Yeah, absolutely. Who at ABS should a new licensee contact within in order to learn the correct process for setting up an iClaim customer? So I think what's being asked here is, who does that new licensee connect with in order to learn or help set up the iClaim, the customer for them, their doctor in iClaim?
Well, of course, our support, personnel are going to guide you through that process. When we have a licensee who contacts a doctor and they say, okay, we got a new doctor, what do we do? Guys, we have a whole process that we go through to implement. And by the way, Eric, you want to tell them what you just did this past weekend?
Absolutely, and thank you for letting me interject here, because we spent Jordan Ransom, our Director of Operations, and myself were out in San Diego this last weekend learning a lot about the implementation, and there is a full spreadsheet that takes a doctor and you step by step of what to do to implement iClaim, all the way from creating what's called a practice champion, which is someone there in the office that you're kind of like they're the champion of that office. They're the one that's going to be basically your ally there in the office. You're going to be working and coordinating with them on step-by-step procedures of things to do prior to going live. There's a process of what you do when you actually go live with the iClaim, and then there's certain things that you're going to do whenever you have a post-go live. So it is so detailed, and it truly is a step-by-step. And not only are you getting the help from that and from us here at ABS, but there's always additional help at every step of the implementation. So you are in good hands. And again, Patrick, even from the day one that I've been here, the whole implementation process has really taken on a very professional, very steady and systematic way of getting these doctors up and going, not only with iClaim, but with EMR, because to some extent it could be a little overwhelming, but again, we've broken it down to very, very basic steps on taking care of each one of those. So you'll never feel like you're too overwhelmed where you go, I don't know what to do. You're here
and Eric, let me just throw this in, because it's important that people know that when we set the company up, we actually set it up on a model based on back-end revenue. In other words, after you've paid your license fee to us as a company for the training and support that we give you, we always want to make money on an ongoing basis. So we have made arrangements with all of our technology partners that actually provide these various services to our licensees so that we, as a company, make a few pennies on each one of the transactions. Now, that gives us a real incentive, doesn't it, Eric, to make sure that these folks are successful. We want them to run lots of transactions through the system and through these different services because we make money on them as well. It's a partnership, and it makes us very committed to you as a licensee to your success.
Exactly. And folks, I can't think of any other business that you might not want to be a part of, but this business is one that you do want to be a part of because, again, we are actively out there helping you get your clients because, again, as Patrick says, once you got clients, you got them making you money. We make money on the back end, which further helps your support and all the other aspects, and saves you as a licensee from not having to pay some franchise fee or royalty fees to us. That's your money's your money.
Yeah, because
I was going to say
I'm sorry.
Go ahead. No, go ahead.
I was just going to make sure that everybody was aware that you're not actually paying any of that money to us on an ongoing basis. That's a rebate that we get from our technology partners. They're the ones that are paying us behind the scenes. So we just want you to be clear on that there are no royalty fees, there's no ongoing dues or subscriptions or quotas or anything like that.
Correct. There's a couple of questions that have come in. I'll ask this one from John because I think John and David are asking very similar questions about rejection rates. So let's talk about what's the average rejection rate that we're finding here with iClaim, and what's the competition's rejection rate, or what's the normal rejection rate that's out there?
Yeah, we have found, folks, that most people are not aware, and they're kind of shocked when they first learn that there are rejection rates in this industry from other medical billers. Well, in fact, I have a slide here. I just opened up a previous webinar we did, Eric, and I'll just put it up here. This is the average number of rejected claims for a medical practice, 34%. Now, folks, that means that the average doctor is billing, say, $100,000 and only collecting about 66% of that.
Right.
In other words, there's a huge amount of that that's just lost to that rejection. Now, some of them get resubmitted, and some of those are rejected again, and so they're constantly fighting to try to get their money. This is why health insurance is so expensive in America. It's why medical charges from doctors is so expensive, is because the doctors are not collecting what they should. Now, when you learn that using our real-time web-based system, that you can get that rejection rate down to less than, are you ready for this? Drum roll, please. Less than 2%. Yeah, and Eric, I've asked that on interviews here on these webinars that we do on Wednesdays. I've asked many, many licensees, and I've never heard one more than 2%.
Correct. I know with some of the doctors that, in our research and development division, that we've got doctors that we do billing for, and it's right at about 1.3, 1.4. And that's to the payers. And that's why it's important to know that we are our own clearinghouse. Not only are we scrubbing those through the iClaim system, but once it gets processed through there and it goes through our clearinghouse, then that less than 2% rejection rate is at the payer level. And this is what that means to the doctor. Bottom line is they can expect at least 98% of their claims being paid. 98% of those claims being paid on the first time by the payers. And that's important. And we're not talking about less than 2% rejection rate at the clearinghouse level. We're talking about less than a 2% rejection rate at the payer level, which that's the important ones. That's your Medicare, Medicaid, your Blue Cross Blue Shields, and your Aetnas. So again, whenever we can show these types of numbers to a doctor, this is what excites them.
Yeah, I mean, it's all about the cash flow for the doctor, folks. So
right.
Yeah.
And it should excite you because you're collecting. Think about all the medical billing companies out there that are averaging 66% of what the doctors are collecting. Well, if they're at that 5, 6, 7, 8%, they're only collecting that amount on that 66%. Do you want to collect 66%, or you want to collect 98%, and then make your charges there? That's a 30% increase in and of yourself.
Well, hey, and Eric, that's the reason why doctors like to outsource their billing, because, folks, when you're charging them a percentage of what you're collecting for them, that's quite an incentive for you to collect as much money as you can, right? And so it works great for the doctor because they've got a fixed number. That is, they know exactly what percentage of their revenue is tied up in their billing because you're charging them. Maybe it's 6, 7, 8%, whatever it is that we work out on the pricing. It's different things for different doctors and volume and so forth. But whatever that figure is, the doctor knows and can bank on the fact that he's only going to pay, let's say, 7%. Whereas when he's doing this for himself using his own staff, he has no idea what his real costs are. And believe me, they're much more than 7%.
That is true. And I think a lot of doctors don't even understand that. If they're doing billing in-house, I think, Patrick, if we can remember back to one of our sales meetings that we had here recently, and I brought up in that meeting, I said, do we really recognize, I mean, I'm talking about from us as an ABS core business, do we realize that if a doctor is truly doing billing in their own office, that they're really operating two businesses? They're operating a medical practice and they're operating a medical billing business. And that in and of itself can be very expensive, and the doctors just don't get it until we can show them and do a practice analysis, show them what's going on, and we can show them the savings if they just get it out of their office, and then the increase of the cash flow that goes along with that. Absolutely.
That's a good way to put it, Eric. I never thought about that. Two different businesses. He's running his medical practice on how to get people well, and he's running a business on how to collect money from insurance companies and the patients themselves.
Absolutely. And when that's why this business can be good for those that are on the call tonight and those that will listen to the recorded version of this. I think when you can kind of grasp that, why a doctor would use you, because I know that we've had webinars on that too, Patrick, where that's all we dealt with is why would a doctor use you? That's one of those tipping points. If we can truly, if you as a prospect looking to get in with us, you can see that somewhat of an epiphany that we all had there.
Yeah, you see the light bulb go off sometimes when people realize, well, in fact, here's a slide that we used in our webinar a week or two ago. And basically, folks, this is a spreadsheet that we give you that allows you to fill out the numbers from the numbers the doctor's staff gives you as to the number of claims filed monthly and the amount of the claims and so forth. And when you plug these numbers in, bottom line, you could save a doctor, or let's put it this way, you're going to increase their revenue by up to, in this case, $150,000. Well, that's nothing to sneeze at, folks, and that's by outsourcing to you rather than paying his own employees to do it inside of his own office. So, yeah, it's much, much better for a doctor to turn the billing over to a specialist who's been trained and who actually does the billing for several doctors, so you know what you're doing, and you know you only get paid when you collect the money.
Exactly. Patrick, there's another question here from Manish, and he's asking the question about these codes and CPT codes, and even getting into the fact of modifiers and things like that, because eventually a lot of people that are on the call or maybe coming brand new into this, you're going to hear about procedure codes and diagnosis codes and modifiers, and we don't want that to scare you off, because again, one of the services that we have is a group of certified professional coders. We have a service that's called Code Right. So anytime you need help with a doctor and their codes, and or like Manish is asking about modifiers, because he asked, can the ABS system help in this situation? And so the answer, what I'm getting to, is yes. And again, Patrick, one of the things that Jordan and I found out this last week, if a doctor, we can help you get your doctors on the EMRX, which you see down there at that lower line down there, the third one over, EMRX, that's the electronic medical records, that a lot of these procedure codes can be inputted, and whenever doctors click on certain things, it will automatically add all the codes and modifiers in the EMR system. So again, the doctor doesn't miss out on any other cash that they could collect. And those are some of those things that we can recognize through some of those reports that you were showing earlier. That's how we can, again, help those doctors increase that cash flow. Folks, it's all down to what can you do to help that doctor increase their cash flow. We have got the solutions to that.
Yeah, and this screenshot that I found, Eric, from one of our other webinars shows some of the ICD codes. They're called diagnosis codes. And as you can see, it has the ICD-9 and the ICD-10 are already showing up in our system as they are becoming available to us. Those are all built in, so you do not need to know anything about the codes, folks. The doctor gives you the codes, and our system just verifies that the codes are correct.
Exactly. Well, Patrick, we got about 10 more minutes to the webinar here, and I'm going to kind of scour and see if I missed any of these questions here. So,
yeah, I'm looking too here, Eric, to see if let's see. Oh, here's Gary. Gary's asking a question about our systems as to whether they're patented, so an ABS owner would be offering services that no one else can. Well, not only are they patented and all that behind the scenes, of course, Gary, but they are also very unique in that we have private labeled these. That's right. Our technology partners have actually private labeled these so that they are individually, each service, named only what ABS licensees can offer. So when we talk about the iClaim system, for example, that iClaim system is our system, and it's branded, as you just saw on that previous screenshot, and I'll put another one up here that shows that the same thing. The iClaim is our branded name. Not anybody else has that system that's out there. So, yes, you've got a very unique product in the marketplace.
Exactly. Here's a great question from Flory, and question is, what would we be able to talk to a few of your licensees before we sign up with ABS?
Absolutely. In fact, we encourage you to do that. We're one of the few companies that have literally, I guess, dozens of licensees that have agreed to take phone calls for people who are looking to get into the business. So, Flory, all you do is get back with your ABS rep and say, look, I think I want to move forward here. I've done my due diligence. I've got my funds together, but I want to make sure you guys are real. So can you let me talk to some people, that have actually been through your training and can verify that everything that you're saying is true? And we'll be glad to do that. And these are people from coast to coast, literally, that we don't ever know exactly what they're going to say, do we, Eric? But we trust that they're saying good things about us because we've always treated them right, and they've been very successful in our business. So
exactly.
Yes.
And one other unique thing, and I don't know if you've done a webinar on this. I know I've been out the last couple of Wednesdays, but we have a competitor out there, but I think, Patrick, we're the only medical billing business to get people involved in this that actually have doctors on our advisory board. You want to talk a little bit about the doctors that we have as our advisors now?
Yes, I actually mentioned one of them earlier there. The doctor that we signed up here locally, of course, is so happy with what we have done for his practice that he has agreed to be on our medical board. Now, what we mean by that is if you go out to our website, you'll actually see a little link out there called, let me just put it up here on the screen and you'll be able to see this live here. I'm going to increase the size of this once it shows up. It's kind of small here, so let me blow that up a little bit so everybody can see it. And you will see it right here under the About Us tab. Go down to Meet the Team. And I don't think we've added Dr. Bustle on this page yet. Let me scroll down and see here. No. But we do have another doctor. Sally Combest is an MD down in the San Antonio area, and she is on our medical advisory board. And then Dr. Bustle is about to be posted on here as well. I just don't see him on there yet, but he should be showing up there soon. So, yes, that's just something very unique in the marketplace, folks. I don't know of any other company that has that type of thing. Medical doctors who are actually willing to talk to other medical doctors who are looking at doing business with you as a licensee in your area.
So, I wanted to share that because lot of people want to ask, what makes ABS different? And hopefully tonight that you kind of heard some of the questions that came out, some of the things that do make us different. We do have a live training that's Monday through Friday, which is fairly unique. We have ongoing training with webinars. We have doctors that are on our medical advisory board to kind of keep us in touch with what's really going on. From a doctor's perspective, we have our research and development portion of our business that makes us unique because we're actually doing some billing. So, and not only that, with the side of actually working the marketing techniques that we talk about. So, Patrick, when we really sit back and think about it, ABS has created itself as a very unique, not only business opportunity, but really one that really people can feel very comfortable with, getting involved with, on the level of, these people are in this. And again, like Patrick said earlier, this is all we do. This is all we do is medical billing.
Yeah, we're focused, folks. We know that in today's world, there's a lot of companies offering a lot of different things. We've decided that we wanted to be the experts in this industry, the medical billing industry. So as far as I know, there's nobody in America who does live, 1 week full live training in our classrooms, teaching people exactly how to get this business kicked off, and then who have lifetime support. Once you've become a licensee, you're always an ABS licensee. There are no ongoing fees or dues or subscriptions or anything like that. You have access to our support and our support websites and marketing materials and all the new services that we're coming out with. Absolutely, is just a part of your package. Eric, I guess we're out of questions.
I know. I was talking and I had myself on mute. I had to cough there for a second. What I was going to ask you, could you go over to where folks that want to look at other past webinars for our
Sure.
live webinars that we do? There was a question earlier on about the Obamacare that you and I did not too long ago. And,
yes.
And then Ori is asking the question about, I missed a webinar on that Obamacare. Can we listen to the recorded version? So do you want to quickly go over there where everybody can find recorded versions of our past webinars? There were some questions that were asked tonight. One was on Obamacare. How does Obamacare affect the medical billing? Patrick's going to show you exactly where to go to find that information.
All right, so go back to our website. Remember, we're at, you can see it right up here in my browser, absystems.com. And under News, you'll see a link there called Blog. That's our blog. And you can go there and see all the new posted webinars and interviews and things that we've posted there on a regular basis. I mean, folks, this is probably updated at least once or twice a week. So it's always new information for you if you're looking into this business. And you can go over here to the left where it says Webinars and actually search through all the past webinars that we've got posted on here. I mean, there are dozens of them. And one of them is on Obamacare. There it is right there. Look down here. You'll see it about the fourth one on this screen, Obamacare. How is it affecting the medical billing industry? That's a whole hour where we talk about this, Eric and I, and that was just back in May. So, yeah,
right.
That would be a good one to go watch.
Well, again, there were some questions that we just didn't get to tonight, and we want to let you know that your questions will be forwarded to the ABS rep that you're working with, whether it's Jason or Adam or Dirk or Alicia or myself. We'll get those questions forwarded to us tomorrow, and we will follow up with you. If we didn't get your question answered, be sure that it will get answered. It may be answered in an email, or we can schedule a call with you. And as we close, I know that we've kind of talked about this in the past too, Patrick, but a lot of people want to know, well, can I see that system work? Folks, if you want to get with your ABS rep, we can schedule a live demo with you to kind of show you, again, the system, how it works, how we show you how it can actually increase the doctor's cash flow, but really more importantly, just so you kind of get a good feel about it. And then also, this is how we do the demos for you, for your doctors. So this is one of those things you can come to expect, that after you become a licensee, how we help you get clients, we do, like we're doing tonight, a live meeting with a go-to meeting like we're doing here tonight, where it's you, ABS, and your doctor helping you show that information to the doctor, and we'll answer all the questions for you.
That's right. And, folks, we do these webinars every week. Now, usually they're at 3 o'clock Central Time, not in the evening like this. This was a very special one. But you be sure and try to be on each one of these. Do your due diligence. Continue to research us as much as you wish and be on as many of these webinars as you wish, because you'll get lots of information about the medical billing business each and every week being on here. So thanks again. I hope I see each one of you at one of our upcoming live training workshops. This one's coming up pretty quick here. What is that, Eric? A week from this coming Monday. So it's pretty close. But, guys, there are seats left. If you want in this one, this would be a great class to be in, because it'll be a little smaller than normal class. And you would be great to be in that class and get your business kicked off as soon as possible. So only 7 seats left in that class right now.
All right. Thanks, Patrick, for taking your time out tonight. Folks, thank you for taking your time out. And, again, with Patrick, we hope to see you in an upcoming training class very soon.
Thanks, Eric.
Thank you. Good night.
Bye-bye.
Bye-bye. Bye-bye.